Greetings, my friends. Today's lecture will be about multifactorial diseases. Bezrukov Grigory Sergeyevich, Doctor of Philosophy in Medicine. Multifactorial diseases are known as MDs. Currently, they are the most common reason for contacting the medical genetic consultation. The purpose of such appeals is usually the desire of the counselors to learn about the prognosis of the offspring or the prognosis of the health of a child or adult already born. Hereditary predisposed multifactorial, like complex genetic disorders, are diseases with polygenetic type of inheritance, resulting from a combination of genetic predisposition and a wide variety of pathogenetic factors, like infectious, environmental, and alimentary factors. Multifactorial diseases depends on polymorphism of genes and the totality in terms of genotype, consisting of the genes of the mother and father. Mechanisms of interactions between allelic and non-allelic genes of the mother and father, between individual genes and the genotype as a whole. The modifying influence of the elemental factors on the action of genes in the case of the plasticity and non-plasticity, the ability to change the action in response to the action of the environmental factor. Reasons for polymorphism: genetic heterogeneity, variety of genetic causes, due to multiple allelism, interaction of allelic paternal and maternal genes, multiple mutations of the same gene. Reasons for polymorphism: polylocus or gene copy of a trait or phenotype. Different mutations in gene located at different loci, both on the same and on different chromosomes, cause the same trait or same phenotype. Violations of differentiated gene expression: the sequential transfer of genetic information from a DNA molecule using various types of RNA to polypeptides. Disruption of gene expression can result from a mutation at any link in this chain. Genomic imprinting: the formation of a trait and phenotype depends on whose hereditary material is transferred to the individual. Differences in the clinical picture of the disease with the same disease in different individuals, both in the same and in different families. Here you can see the example of deletion. Here you can see the example of deletion plus duplication. Here you can see the example of insertion. Here you can see the nonsense mutation. Multifactorial diseases can be divided into congenital malformations, common mental and nervous diseases, common diseases of middle age, congenital malformations of a multifactorial nature, cleft lip and palate, spinal hernia, pyloric stenosis, and other examples like clubfoot. Genetic predisposition: the implantation of external factors in the MDs is possible if there is a predisposition to a particular pathology. Genetic predisposition is a change in the norm of the body's reaction to the action of environmental factors, which is determined by the individual variation of genes that determine the individuality of the structure of organs, physical functions, enzyme levels, etc. Due to it, the same external influence in terms of intensity is harmless for one person, while for another it leads to the formation of MDs. Features of the organism make it more effective to MDs. Immaturity of central regulatory mechanisms, increased permeability, like vulnerability of the skin and mucous membranes, immaturity of local and general immunity, immaturity of the enzymatic systems of the liver, low glomerular filtration of the kidneys, etc. Here you can see how goes the etiology of MDs. Environmentally conditioned diseases are diseases that have developed upon the population of a territory under the influence of harmful environmental factors on people and are manifested by symptoms and syndromes characteristic of the action on this causative factor or other non-specific abnormalities. They can be associated with either natural causes or human activities. Industry and ecology in a historical aspect. Over the past 100 years, mankind has increased production by almost 100 times and energy consumption by almost 1,000 times. As a result, in such a relatively short period of time, a huge number of chemicals were released into the atmosphere. About 4 million of them were recognized as potentially dangerous to humans, and over 180,000 have pronounced toxic and mutagenic effects. Such a short period during which environmental pollution occurred fell on the period of the life of only a few generations of people, which relative to 3 and 3.5 million years that have passed since the appearance of man is only a short moment. These types of pathogenesis, which is caused by the environment, it is explained by mutations of many genes that act in the same direction, complementing each other. Perhaps predominantly the influence of one gene. Pathological properties of MD's genes are manifested only under the influence of unfavorable environmental factors. The relative role of the environment and heredity is different for each MD and for each person individually. General characteristics of these MDs caused by the environment. The presence of associative and pathogenetic markers of hereditary predisposition. Chronic course with the presence of a clinical continuum. Early onset and deterioration of the clinical picture in descending generations of the family. An increase in the risk of having a sick child in each subsequent generation. The same type of manifestations of the disease in one patient and next of kin. Increased risk of the rebirth of predisposed children with the advent of each subsequent child. In contrast to monogenic dominant and recessive traits, the risk of these MDs that caused by the environment for relatives varies greatly from family to family. In contrast to monogenic dominant and recessive traits, yes, the risk of varies greatly from family to family, and this risk is higher in families with two affected members compared to families with only one affected member. A more severe severity of the disease in the proband is accompanied by an increased risk for relatives. Here you can see how it goes. Heritability coefficient expresses the proportion of genetic factors in the development of MDs in percents of the combined action of genetic and environmental factors, taken as a total of 100%. With different MPs, this coefficient varies widely, but for the group as a whole, more than 50%, but less than 100%. It is calculated empirically. If there are no data on the familiar frequency of the MDs in the literature, then data for relatives of the first degree of kinship can be used approximately, where the risk is equal to the frequency of the disease in the population. Here you can see the numbers of risks for the following diseases. Bronchial asthma. Prevalence from 4 to 8% among the general population, in the children's population up to 10%. Asthma is a disease based on chronic allergic inflammation of the bronchi, accompanied by the hyperreactivity and intermittent attacks of shortness of breath or suffocation as a result of widespread bronchial obstruction caused by bronchoconstriction, mucus hypersecretion, swelling of the bronchial wall. Recent evidence suggests that three sets of traits are inherited independently of each other. Genes that predetermine the production of specific are localized on a short arm of chromosome 11 and associated with class II alleles. The control of the basal level of total is carried out by the gene cluster of the long arm of chromosome 5. Bronchial hyperreactivity is associated with genetic markers of the same segment. The genes for interleukins that activate mast cells and the gene encoding receptors are located on the same side. Here you can see what causes this disease. Peptic ulcer disease. A chronic relapsing disease characterized by the formation of a stomach or duodenal ulcer due to a violation of the general and local mechanisms of the nervous and humoral regulation of the main functions of the gastroduodenal system and trophism, as well as the development of mucosal proteolysis. From a genetic standpoint, peptic ulcer disease can be divided into four main groups. Peptic ulcer disease in general as a disease with a hereditary predisposition characteristics of MDs. 2. Peptic ulcer which fits into monogenic, usually autosomal dominant type of inheritance. 3. Peptic ulcer as one of the clinical manifestations of several hereditary syndromes. 4. Ulcerative lesions of the gastroduodenal system in some somatic diseases. Diabetes. It is heterogeneous disease in etiology and pathogenesis in which both internal and external factors are involved, the interaction of which leads to a violation of carbohydrate metabolism. The role of genetic factors in the development of diabetes. 1. Diabetes, as well as impaired glucose tolerance, is a constant component of approximately 45 hereditary syndromes. 2. Various clinical manifestations and prevalence of diabetes in ethnic groups are not always explained only by difference in environmental conditions. 3. Among patients with diabetes, there are groups of people with different dependence on insulin. 4. There is adult diabetes, which is inherited monogenetically and is an autosomal dominant manner. 5. Various variants of diabetes can be simulated on experimentals. The development of diabetes is affected by a mutation in one or more genes, formation of pathological phenotype, the development of clinical manifestations of diabetes mellitus in the presence of a hereditary predisposition occurs with the mandatory participation of environmental factors. In the etiology of diabetes, various stress factors, infections, injuries, and operations are of great importance. For insulin-dependent diabetes, risk factors are some viral infections and toxic substance. For non-insulin dependent diabetes, risk factors are overweight, hereditary burden by diabetes, atherosclerosis, arterial hypertension, decreased physical activity, and unbalanced nutrition. Coronary heart disease occurs as a result of a decrease or cessation of blood supply to the myocardium due to pathological process in the coronary vessels. The main part of this disease is a multifactorial pathology characterized by the formation of the disease in the process of interaction of genetic and environmental factors that lead to immediate causes. Genetically determined risk factors for coronary artery disease include gender of the proband, body type, and personal characteristics. Genetically determined risk factors for coronary heart disease include a certain structure of the coronary vessels, elevated levels of total cholesterol in the blood, high blood levels of low and very low density lipoproteins, low concentrations of high density lipoproteins, low activity of these receptors of lipoproteins, disorders in the blood coagulation system, and arterial hypertension, and diabetes. Xeroderma pigmentosum. Molecular genetic mechanism. mutation in several gene loci, which control DNA repair processes. This leads to disruption of DNA repair processes by normal after damage by ultraviolet rays. A set of measures that can potentially provide optional conditions for the maturation of the egg, its subsequent development, implantation, and as a result, the development of the fetus. From a genetic point of view, preconception prevention is an attempt to eliminate the conditions and factors that can contribute to the expression of pathological genes. Preconceptual prevention is carried out in relation to congenital malformations and other multifactorial conditions, not determined by Mendelian inheritance. Prevention is carried out after medical genetic study of the family, during which the genetics determines the nature of the inheritance of the disease, repeated genetic risks, and the possible effectiveness of prevention. The plan of action: treatment of chronic foci of infections in future parents, treatment of chronic somatic diseases, spermogram evaluation, sexual regulation, pregnancy planning, diet enriched with vitamins and microelements, including folic acid. Usually, prophylaxis is prescribed and carried out by a certain doctor, if necessary with the participation of other specialists. Indications for preconception prophylaxis: genetic risks of multifactorial defects and MDs in a family, repeated spontaneous abortions and the birth of dead fetuses, the birth of children with prenatal hypertrophy and history of premature birth, diabetes, other endocrine and metabolic diseases in a mother, different MDs, eating disorders, long-term use of drugs, diseases caused by touch infections. Pharmacogenetics: identification of genetically determined features of the individual reaction of the body to various pharmaceuticals. According to some reports, more than 100,000 people die every year in the world due to improper dosage of drugs, ignoring the individual variability of the effects of drugs. Here you can see the so-called genetic passport. Genes of predispositions to MDs: osteoporosis, neural tube defects, myocardial infarction, atherosclerosis, oncogenesis, breast cancer, bronchial asthma. Antidepressants and neuroleptics, warfarin, metoprolol. Genes of predisposition: The task of increasing the level of genetic education of the general population is relevant not only in Russia but throughout the world. Back in 1994, the European Committee on Biomedical Ethics launched the Ethics of Genetic Screening project, and in February, the first International Genetic Advisory Center was opened, in which any person can receive qualified advice or any medical genetic problem, including predictive testing. Conclusion. At the heart of monogenic diseases are mutations of individual genes that can be dominant or recessive. Changes in the structure and number of chromosomes lead to chromosomal diseases. However, in many cases, human birth defects result from a simultaneous appearance of a complex of different mutations. These are the already mentioned multifactorial diseases or polygenic diseases. Many congenital malformations are due to multifactorial inheritance. MDs also include such widespread diseases as diabetes, hypertension, coronary disease, asthma, etc. They are the result of a complex interaction of many genetic or environmental factors. Thank you for the attention.